Nocturnal dialysis is dialysis done overnight, and it's generally done 3 or more times a week, as many as 7 times a week. And again, the more frequently you do it, the better you are. But 3 times a week overnight is so much better than 3 times a week short dialysis, which is so typical of in-center dialysis. So if you do it more than 3 times a week, if you do it 5 or 6 or 7 times a week, you get the best possible treatment that's available today. Longer dialysis is better than shorter dialysis because when one dialyzes, a lot of the small molecules come out very quickly, so that 2-3 hours of dialysis is fine. But larger molecules, like the ones that help to cause arthritis in long-time dialysis patients and phosphate, move much more slowly, so the longer you dialyze, the more of these larger molecules you get out. One of the main advantages of both short daily and long nightly dialysis, in other words more frequent dialysis, is that the episodes that so commonly occur in dialysis patients who dialyze in a center, such as low blood pressure, cramps, and feeling rotten after dialysis, just disappear when patients are treated more frequently. And I often tell patients that it's like driving a car. You don't need to know what's under the hood of the car and how it works. You don't need to know what's in the dialysis machine and how it works. All you have to know is how to use it correctly. If you dialyze more often than the 3 times a week that's typical of being in center, your diet can be greatly improved. And in fact, if you do long nocturnal dialysis, nightly dialysis, you can eat basically a normal diet. The other advantage with long nightly dialysis, and with short daily dialysis to a lesser extent, is that you can certainly drink more fluid. The fluid restrictions that you have to have if you're going to go, for example, 2 days between dialyses over the weekend are no longer there. There's clear evidence that patients die from cardiac causes and sudden death more frequently on Monday after they've been off dialysis for 48 hours or more than they do any other day of the week. If I had renal failure, the treatment of choice, to my mind, would be long nightly home hemodialysis, 5, 6, 7 times a week. And in fact, from what I've seen, I think that it is so close to being as good as having a transplant that as an older person, I think I would probably stay on dialysis.